Every day across this nation, in ERs just like this one, thousands of people rely on doctors and nurses to save their lives. Effective communication can mean life or death in the emergency room. Devin has been a registered nurse in the ER for about a year. Coming from the millennial generation, she gets extremely frustrated with the older docs and finds them very difficult to communicate with. This is Dr. O'Hara. He's been on staff here in the emergency room for over 30 years. His basic disposition is cranky and agitated. He says it's mostly because he's irritated with the younger nurses, as he says they are always wanting to do things their way and they never want to stop and listen to him. Today, much to Devin's disappointment, she has been assigned to share the care of this elderly lady with Dr. O'Hara. As Dr. O'Hara gives Devin the chart, he also gives her a medication order. She thinks she hears him order epinephrine. She is very confused as to why he would order this medication on this patient. However, she just takes the chart and says nothing to him. Devin decides there's no way she can handle a conversation with grumpy old Dr. O'Hara, so instead she heads straight for the medication dispersal machine and prepares the medication for administration. Jamie has been a registered nurse on staff here in the ER for about 15 years. She realizes what is going on and she approaches Devin to discuss it. Jamie gets out the drug book and shows Devin that epinephrine is never to be given intravenously except for life or death situations. Jamie and Devin discuss how very important it is to have good communication skills in preventing medication errors. Jamie tells Devin that her and Dr. O'Hara are going to have to find a way to communicate in the future because it's a matter of life or death. Devin is completely devastated when she realizes that her medication error could have almost killed her patient. She talks to Jamie and they both decide that they need to go have a meeting with Dr. O'Hara. Jamie and Devin approach Dr. O'Hara and Devin informs him of everything that's happened and how she thought that he had given her an order for IV epinephrine. Dr. O'Hara says that he had ordered heparin on the patient, not epinephrine, and asks Devin why would she not have come and clarified that with him. Devin tells Dr. O'Hara that she finds him extremely difficult to communicate with and that just most of the time he's plain out rude and grumpy. Dr. O'Hara denies this completely. Dr. O'Hara tells Jamie that he feels like she never stops and listens to him because she feels like she knows everything already. The three of them discuss that they most definitely do have a communication issue based on their generational gap. But they realize that if they don't agree to work on a resolution, that something catastrophic could happen in the future. Jamie, Dr. O'Hara, and Devin agree to move forward and make an effort to improve their communication skills, not just among the three of them, but throughout the entire ER. They selected a new motto, to meet in the middle for better medicine.